and welcome to another episode of the Young Tongues podcast. My name is Barbara Fanton and I am the founder and CEO of the Young Tongues, a peer-to-peer support charity for young tongue cancer patients. And welcome to our second ever panel discussion for this podcast. I'm really excited about today because actually this is for my own personal research, but it is also one of the topics no one really talks enough about until they're in the group and until it affects them. And the main thing we are talking about today is pregnancy after tongue cancer. So I'm welcoming three fabulous women, fabulous friends and women who've been with Young Tongues for quite a long time, and we've been through all the ups and downs together. Welcome to the podcast. I'm going to go one by one so you can do a quick intro. Nat, let's start with you. Welcome to the pod.
Thank you. So I'm Nat, I'm 36. I was diagnosed when I was 33, so 3 years ago. I had a partial glossectomy, neck dissection and reconstruction. And very thankfully, I was then all clear, so I didn't require any further treatment. So I've been all clear now for 3 years.
Amazing. Thank you, Nat. And Chloe, welcome to the pod.
Hi, so I'm Chloe. I was diagnosed when I was 30. Which was 5 years ago now. And same as Nat, I had a partial glossectomy, a neck dissection and reconstruction, and didn't have any subsequent treatment after that. So I've just gone past my 5-year mark.
Fabulous. Congratulations, Chloe. And Sarah Jane, or for the purposes of us saying it faster, SJ, lovely. Welcome to have you finally on the pod. I've been badgering you for ages. So if you can give us a quick introduction.
I'm SJ, I am 42 and I was 38 when I was diagnosed. I had a partial glossectomy and a neck dissection, and I have very thankfully been NED for 4 years now.
Amazing, thank you. So let's start at the beginning. I think most of you had the same experience as I did, because pregnancy or fertility were never mentioned in any of my consultations when diagnosed. Just wanted to ask and check in. Did you have any conversations with your consultants about pregnancies? Chloe, do you want to go first?
No, is the short answer. I do remember asking my clinical nurse specialist pretty early on, because I think it was quite front of mind for me at the time. And it was sort of fobbed off a bit as not being something to consider now, I guess, because we were talking about surgery and not chemo or radiation at that point. But that was the only time it was mentioned. It's certainly, not until I brought it up post-treatment.
Absolutely. Nat, what was it like for you?
So similar to Chloe, it wasn't mentioned to me, although I asked the question. So when I was diagnosed, I asked the question. We were actually trying for a baby when I was diagnosed, so it made sense to ask the question. And it was very much we'll talk about that if it comes to chemo. And that was kind of the answer.
Okay. And SJ, maybe you want to give us a bit more insight into your technical knowledge on the subject, not just fertility, but I mean being a doctor in general.
Yeah, so background is, if people who don't know me, I'm a MaxFax trainee. So when I was diagnosed, had just started my training, and my consultant training, and we were very much sort of in the throes of planning for. We already have one child as a 3-year-old, but we very much wanted to give him a sibling, and like diagnosis kind of just took the wind out of my sails. And so it was very much, as I think you other guys have mentioned, it was very much sort of front and centre in my mind. So I did mention it to the consultant, but I had to mention that, and it was not something that was brought up with me. It wouldn't have been discussed if I hadn't raised it.
Yeah, absolutely. And I think this makes this conversation even more interesting, Sarah Jane, because you come from a MaxFax background. For anyone who doesn't know, MaxFax is the surgeon who performs the glossectomies, amongst other things, as part of a wider team, but are quite often, not often, I think always the lead consultant. So the person that we speak to most, especially in those early days. So I guess, Nat, I'm so sorry, my brain was obviously not listening properly. Am I right in thinking did you have radiation or not?
No, I didn't. No, just surgery.
Okay, so So all four of us had surgery only. Would have been interesting to have someone on who's had radiation or chemo to see, because I do know from the group we do have some people who did have radiation, had children after. But I guess from the point of view where we are right now, having gone through the surgery and recovery, when did you guys even start thinking about like baby? Well, not just babies, but making babies, because oh my God, it took me a long time to want to go anywhere near my husband. But yeah, how was that? Was it something that you felt like you wanted to try and do as quick as possible in order to get pregnant? I don't know, who wants to go first? It's a terribly personal question.
I mean, I think I asked the consultant after I got my pathology back, and they said, which was about 10, I don't know, maybe a week after I'd got out of hospital. I remember then ringing him back or ringing the nurse back and saying, hang on, I've actually got loads of questions now, because in my head I was geared up for it was going to be bad results, I was going to have radio, and then suddenly you're sort of like, I know lots of cancer patients say this, but you're sort of spat out the system, aren't you? And you're like, right, well, you're done, off you go. And I had loads of questions, and that was one of them. And I remember him saying, well, you're cancer free now, so there's no need to wait if you don't want to. And it sort of haunts me a little bit, some of the decisions that I then subsequently made, the risk that perhaps I took or didn't take, but it feels like a risk to me. And so it was sort of like, I don't know, I think you're in quite a strange place mentally at that point, and you sort of, what I certainly wanted to get on with my life and almost put it back. And so we did start trying quite quickly, and I fell pregnant quite quickly. And it was a really crazy time, to be honest. But yeah, that's what happened with me. And I think a lot of it is a sort of mental side of thinking, oh, well, I might not have been able to have children, and now I can. And so, you suddenly want to do it quickly. It's a decision that still scares me a little bit because of what could have happened if I'd had a recurrence. But yeah.
Yeah. You were, I do now remember, you were within a year, weren't you? Pretty much.
Yeah. I fell pregnant really quickly. I did have a miscarriage, and then, I fell pregnant with my now nearly 4-year-old. So yeah. But I mean, I think in my head, all of that is kind of, until I sort of say, until she was born, it's all the sort of same episode of my life almost. I sort of started to maybe deal with the trauma once she was born, of the cancer and everything. It was sort of, I don't know how to describe it, but yeah, it was all the same sort of period of time for me.
What was it like for you?
So actually really similar to Chloe. We'd been trying for our second child at the time I was diagnosed. So when I got told that you're not going to need any further treatment, no radio, no chemo, I asked, can we go ahead and try again? And they were like, yeah, absolutely, go for it. And much like Chloe, we also fell pregnant very quickly. So I was pregnant within a couple of months of my surgery, which was just a mad time, really, because I hadn't processed anything, And again, just like what Chloe said, I don't think I did process really until probably a year or two then again. Because life was a roller coaster at that point, You'd kind of gone from this, oh my gosh, I've got cancer, to, oh my gosh, we're pregnant, we're going to have a baby. So yeah, it was just a bit of an absolute roller coaster of emotions, happy, sad.
Yeah. Sarah Jane?
So I actually raised it before I even had my surgery, when I had one of my initial appointments with the oncologist and the surgeon. It was a bit of a weird conversation because my surgeon, who I very much respect, he'd also been my boss just a couple of months previously, but obviously he understood my sort of drive for asking it, and I was told in no uncertain terms that he wanted me to wait for 2 years, and we sort of came to a decision with the oncologist, with sort of reasoning it through because of my age. Obviously, there was a bit of time pressure, that they wanted me to wait for a year. So that brought up for me another question of whether I should be speaking to obs and gynae to discuss fertility preservation, because I've got a family history, sort of going to my medical background of premature ovarian failure, which is premature menopause. So hitting my late 30s, even though I didn't go on to fortunately need the radiotherapy, chemotherapy, there was that pressure as well. So that opened that discussion, and that sort of led to different things.
And I think in
That's great. Thank you,
retrospect,
sir.
I would have waited. It makes sense to wait 2 years. I think it wasn't the advice I was given, but logically that feels better now when I look back in hindsight to have got to that milestone. I get why I didn't, and I get why you didn't, SJ, but it's strange to me that we were given different advice, and your advice makes more sense, I guess, logically now.
Yeah, I
Absolutely.
can see why,
I
because it's not
also
obviously a sort of hormonally.
sorry, SJ.
SJ, you go ahead.
So it's not a it's not a hormonally driven cancer as such, like a breast cancer or a sort of female gynae cancer. But I think the sort of thinking behind it, although there is no hard and fast rule, there's no evidence about this that we can delve into to sort of to go to for reference. The sort of evidence at the moment suggests that the risk of recurrence is highest in the first 2 years, and we know that I'm not. And I preface this by saying I'm not an obstetrician, and I know there are some obstetricians in our group, so I apologise if I get this wrong. But pregnancy is a sort of immunologically privileged period where your immune system is dampened down to a certain extent. Because if you think about it, you're sort of carrying a baby that's not just part of you genetically; it's part of your partner, or the sort of a donor, if that was the case. But it's not all you. So your body, if the immune system wasn't dampened down, could potentially attack that baby. But obviously, we rely on our immune systems to prevent us from getting cancer. So there's that balance.
Nat, you wanted to come in.
I was just really going to agree kind of with what Chloe said. I think for me, from a mental health point of view, I also probably would have liked to have waited. But I think I also felt that kind of pressure of, well, what if it does come back? So let's crack on, because then if it does come back, at least we've had our second child.
That's what the consultant said to me, which now feels quite, I don't know, imagine being in that position that you have a baby and then, I don't know. It's a very difficult place to be, but he did say that to me as well.
It's really interesting. I just thought I'll bring a slightly different point of view. So I, at the time of my diagnosis, was 32, freshly engaged. The plan was, get married, start having children. We did get married. Took a bit longer thanks to COVID. But even that life momentous event felt rushed because I was still trying to deal with what had happened to me. And now looking back, even though we had the most wonderful of all weddings, I do think it led to some mental health issues by making big life choices just straight after cancer that I kind of wish I would have given myself more time. On the flip side, I'm now 7 years out. I'm going to hit 40 next year. And I have most definitely been avoiding getting pregnant because of all the fears and everything that you've mentioned. But it's taken me this long to get as ready as I am now. And I'm now, about to hit 40. And everyone like in the GP I speak to is like, oh my God, get pregnant now. And again, everyone's really rushing me. And I'm like, oh, but my body will just do what it wants it to do. And yes, I hope it's still possible. But it's this real kind of like double-edged sword of like that constant clock ticking, but also wanting to be ready for the experience of having a child and then having the mental capacity to be a mother. So I guess if we just move forward in the timeline, once you were pregnant, firstly, how did you feel about it? But also, what were your concerns at the time, and where were you able to get answers for some of the questions that you may have had?
can go first. I think,
Go for it, Chloe.
yeah, I was very happy to be pregnant. I was very excited. I think I was, I, s- I didn't really have anywhere to go to for questions because, I think within the midwives, and I was reviewed by a registrar that was deemed, you don't need us, you don't need both scans or whatever, you're fine. So it was all sort of midwife led, and I don't think it's not something that comes up probably that often, this situation. And so I don't think I had any different treatment at all, or really had any where to go with questions. And I think more for me, that experience was more the sort of mental side, as she mentioned at the start, about being in a hospital and having all the scans and things like that. I remember sort of counting in my head down sort of, okay, I'm 7 months pregnant now, the baby could be born and be okay if the cancer came back. And that was very much the kind of mindset I had. It was very much leading up to getting the baby out safe in case something happened with my body. I don't think there was much thought about what happened after that. And actually, I would say I had quite a positive sort of postpartum period because I was so relieved that it was over and she wasn't relying on my body anymore. But yeah, there wasn't any specialist kind of care or any additional support, which I think there should have been from a psychological perspective. That was the hardest part.
That. Yeah, so I had a slightly different experience. I'd also had my son a couple of years prior to that as well, so my first son. So that was in 2020, and then I was diagnosed with cancer from 23, although I had pre-cancer in 21. So I'd had kind of a normal pregnancy, if you will, pre-cancer, and then I experienced having my second son after. And there were some differences for me. So I was consultant led. So I think it's so interesting that we were experienced different treatment again. So at the first time round, I was midwife led because I had no complications. And second time round, I was consultant led the whole way up until about the week, I think, before I was due, at which point they signed me off because the cancer hadn't come back. But I was basically watched kind of until then. I only had to have a couple of extra appointments along the way with the consultant, and they just checked that I wasn't concerned about the cancer, basically. And they spoke with my cancer consultant before signing me off to say, yeah, you can go ahead. They also checked my throat.
I had that as well.
In case anything goes wrong and you need to have breathing tubes and that kind of thing. So yeah, also had that. I definitely had worries whilst I was pregnant because I'd had the pre-cancer after my first son, just before he was a year old. And so it always weighed on my mind, kind of, had pregnancy played a part in it?
Yeah.
Had the hormones played a part in it? Will that happen again? So there was definitely that kind of part of, is it going to come back whilst I'm pregnant? And yeah, having that kind of worry the whole way through, just like what Chloe said. And then afterwards being like, oh my gosh, okay, they're out, they're safe. What will be now, you know? So yeah, that was kind of my experience of it. Jay?
I've had 2 babies now since cancer. The youngest you could hear before screaming in the background. So both times I've been under consultant-led care. That's partly because I had some complications after I had my eldest son. But obviously, once I mentioned that I had the history of tongue cancer, they immediately put me through into what they call the high risk MDT. So it was high risk, sort of maternal risk, as it were. And their main concerns were just, obviously risk of recurrence, but also, as the other ladies have mentioned, just airway concerns when I actually had the baby. So they discussed me at their MDT, which they have in obstetrics, and they coordinated with my team. I let my team know early on, and they gave me sort of extra follow-ups for a bit. So I think I was on 3 monthly at that point, and they sort of brought it down and gave me a few more ultrasound scans just to keep a closer eye on me. But fortunately, everything was pretty good. the first pregnancy. Second pregnancy, I had some breathing issues, so I was quite anemic, and that caused a bit of concern actually. And it turned out it was actually the anemia that was making me, and sort of gravid uterus sort of pressing up on my lungs, that was making it difficult for me to breathe towards the end of the pregnancy. But there was some concern whether there might have been a recurrence and it might have spread to my lungs. So there was discussion as to whether we needed to have a scan for a PE and potentially to rule out any metastatic spread to my lungs. So that became a bit of an issue towards the end of the second pregnancy. But after that, it was okay.
That's
I think all three of us just pulled a face of going,
yeah, with big fear. I don't think there was any discussion between obstetrics and my Max Facts team at all. I don't think they spoke at all. So it's amazing how different we're all in the UK, all under the NHS, how different that care is. Yeah.
Worries
did
me
you
a
guys
bit.
ever get a yeah. Did you guys ever get a explanation in terms of the breathing airways? Is that to do with the type of surgery that we had?
Mhm. Yeah, so they said
Yeah.
it's because it's slightly, and I think they spoke to the hospital because I'd had an operation on my tongue subsequent to the tongue cancer, and they grade sort of how open your airway is. So that's probably the wrong terminology, but yeah, that was their biggest concern. The anaesthetics team were concerned with both my pregnancies about that. They wanted me to have an epidural and things like that to avoid having a general.
Yeah.
They checked for me as well how far my mouth could open. Just the consultant looked. Basically, I had to open my mouth, and they looked at how far I could open it. I think to see if they could get a breathing tube in.
Yes, if anyone had trismus or something like that, that could be a real problem.
Also to plan the eventualities. So sometimes obviously things can go a bit pear-shaped quite quickly when babies are coming into the world, and normally it tends to happen overnight because they don't normally come during the day. A lot of them come at night. So if you think about it, when there are fewer people in the hospital around, and it's probably some anaesthetic registrar who might have never dealt with a head and neck patient before, if they've planned beforehand and you've seen the consultant anaesthetist and they've written a nice clear plan, if this happens, this is what to do in this eventuality, you do this, and this, it's quite sort of reassuring for someone who might not have had head and neck experience before. So they know that there's like a set plan that they can follow should they need to intubate or tube someone, which doesn't happen to my knowledge. I'm not an obstetrician that often, but it is a potential. Like if you had to go for a crash section and the epidural didn't work or the spinal didn't work for some reason.
So, from a timeline perspective, we're going quite fast. So we're at birth stage. So I guess my questions are in terms of like looking this through the lens with tongue cancer, but also it'll be relevant to to all of us looking to go through that. Without going into the gory details of births, because everyone has got different experiences, and I hope all of your births are as easy as possible. But how did you feel having had the experience having tongue cancer before changed your experience of giving birth, and maybe the anxieties that you had that came with it, and what followed after? You know, the tiredness, the feeds, the stress, but also the euphoria of it all.
Can go first again. So the first
Go for it, Chloe.
The first time I had an emergency C-section, I wasn't in labour, so that all happened really quickly, and I had no pre-warning to it, and I think actually having had cancer or having been inpatient in hospital for a long period of time, I was less shocked by then suddenly being in hospital for 2 days. You know, you kind of know the routine of a hospital. You know, they're going to wake you up every 4 hours, and you know, all of these things that if you've not been in hospital before, when I've spoken to friends, I think it's quite shocking if you then have an emergency C-section. The second time, and I only gave birth, my daughter's 3 months old, I had a planned elective. And after a couple of years after I had cancer, I got diagnosed with PTSD as a result. And actually the second pregnancy, going into hospital all the time was really difficult. And I remember getting into the C-section, I was the I was third on the list, but I got moved from the morning to the afternoon. And that whole day was just very traumatic, waiting and waiting. I remember being on the table and the anaesthetist trying to make small talk with me. And I had to just completely leave the room because of all of the equipment. I remember them putting the iodine on and that smell just bringing so much back. So that was the bit that was most difficult, I think, of it sort of bringing it back. The bit afterwards, actually, the tiredness, I don't know, maybe you've been through worse, so it doesn't feel as hard. I don't know, that bit I didn't find as difficult personally, but that as you get bigger and bigger and your body starts to change and it feels uncomfortable, and that was bringing back loads and loads of parallels, I guess, with that time in hospital after having that huge surgery and how awful and scary that was.
Oh, Chloe, I'm really sorry. I didn't know, well, I probably did know about the PTSD, but I wasn't aware the parallels between the two. Was that something you were able to voice with your team, and were they able to support you through that?
I did. I always disclosed it and said it. I don't think people really know what to say. I didn't have any extra support. In hindsight, being the first on the list would have been much better that day than being third and having to wait all day. My biggest fear was I was going to get sent home and have to go through this all again. But yeah, it wasn't really, I don't know, it wasn't really taken that seriously, I would say. I don't know, maybe I sort of just came across fine. So, maybe that's my sort of just who I am. But yeah, that was the trickiest bit.
Yeah, I just, we're all young, we all mask, right? We're all, because I think we do this weird thing when we go into clinical settings that we want to be their favourite because we want them to do a good job with us. So we try to be as unproblematic as possible, which sometimes can make it hard for us to actually voice our needs. But I would like to think that you mentioned to someone, look, I have PTSD from my cancer diagnosis, they would have asked you about triggers, about settings, smells, because all of that doesn't, our nervous system picks it up.
I think partly, and this is maybe a very UK thing, but you don't see the same person twice, really. That's very rare to see the same person twice. And I think I didn't want to go through the story every time and have that, oh, I'm so sorry, and I know people mean well, but I'm sure we all are fed up of having to tell us the same story and have the same reaction. And so there isn't that continuity of care. There is in terms of keeping the baby safe and you safe, but in terms of that sort of more pastoral side, it's not there. And you don't want to keep having the conversation, honestly.
What impact do you think that has, having to go through that? What impact, because it's still 3 months, so I'm still actually quite conscious that you'll probably still have some hormones racing through you.
Yeah. I don't know, honestly. I don't know. I know I don't want to have another child, and that is really because of pregnancy, and it was a very difficult decision about whether to have another child who I really wanted, but that the toll that pregnancy took mentally, to be able to do that again. And I really don't want to have to go through that again. And that is quite sad, that it's the pregnancy part and that's the PTSD part. But then equally, I'm very lucky that I survived cancer, and you're very aware of that as well. Each child feel, like a blessing. It could have been a very different story. So there's lots of things at play, I guess. Lots of emotions you sit with.
Thank you, Chloe. Nat.
Yeah, so I was very fortunate. My birth, the second time round, did go very smoothly, actually. So I think I was very fortunate in that sense. My first birth was very different, although of course that was pre-cancer. So that was a much more, I had to have intervention, and there was a lot of people in the room. And I think if that had been the second time, I would have found that quite overwhelming. But I was very fortunate that I got to give birth in the birth centre in a pool, and it was a very sort of relaxed, not too clinical environment. And I think that certainly helped. The one trigger that I did have was actually the gloves, the smell of the gloves. And I hate that. Such a trigger for me. So yeah, I think I had that kind of trigger. But otherwise, I was very fortunate. I wasn't overly triggered by it because it was such a different environment to what I'd experienced when I was in with tongue cancer. Fortunately, as well, it was a different hospital for me. I go to Bristol, but I live in Swindon, so it was a different hospital. I think that helped as well. So you kind of got a different association with different hospitals. The one thing I do remember is I had to have some stitches after, and speaking with the doctor, who was absolutely lovely, and telling her about my experience and, oh, I've had tongue cancer. And it was just the most perverse experience as you sit there while someone is doing something incredibly personal to you and you're just showing them your tongue, like, yeah, you'll never believe it. So it was just such a strange situation to be in. But overall, I think I was very, very fortunate that it wasn't very triggering for me. But I think because it wasn't so clinical.
I always find that those weird moments are quite often the most human, and they stay with us, but in a kind of quite loving way, because they do take the tension out of the room as well, which can be really helpful. I think that's such a good point that you made about having a different hospital and having that different association. So we have one big local hospital, so I know where I'll hopefully end up going. But yeah, it's weird. I've never been to that hospital for anything other than cancer, so that would be really interesting to see what that experience is like. SJ.
Yeah, so I guess I work in a hospital, so yeah, I don't necessarily have the same associations with all the clinical stuff, because theatre is kind of my domain where I hang out kind of a lot, so I'm used to a lot of the sounds and smells there. But what always gets me is it's so different being on the other side and being a patient, and it's a massively humbling experience, and it really teaches me a lot as a doctor, and I think it informs my practice a lot. I think my birth experiences were quite different. My first son, my eldest actually, who I had before cancer, he was born in the same hospital where I had my cancer treatment. He was born by emergency section, and things went a bit pear-shaped with me after I delivered him. I had something called postpartum preeclampsia, where your blood pressure spikes, and it was actually quite severe. Lots of drama, lots of people in the room, lots of very scared looking obstetricians. Unfortunately, a super cool anaesthetist who held it all together. But I had a bit of, I guess, PTSD kind of thing from that. So going into having my second, who was in a completely different hospital, like close to where I live now, we were actually coming up to having coming up to the birth. It was an elective section this time, a planned section. I was probably more concerned about that, what had happened before, and my husband's affected by it as well, as he was there. He was fortunately the one who went and got the whole crash team, got everybody involved, and probably saved my life actually at that point, I have to say. Thanks, Alex. But yeah, so it's a completely different experience. But I look back after having my second baby, which is after the cancer, and there's this picture of me, and I look at holding the baby, holding Theo, my middle child, and I just look euphoric, because it's just like, this is the baby we never thought we were going to have. When we got that diagnosis and being told that, oh gosh, you've got to wait, and with my age, and then speaking to obstetricians, and they're saying, oh, actually, it's going to be difficult for you to have a baby without help. And here was this little bundle, and I think I've actually sent you that picture, Barbara, of me sort of in a hospital gown holding Theo. And I just look euphoric, and I look so happy, and I was, and it was a completely different experience to what I had with my first. Not to do with cancer, but it was just sort of relief, and he's here, and I've got him, and yeah, it was just something else. And yeah, I have had concerns with, obviously, my second pregnancy after the cancer, most recent one with Mimi, obviously the concerns about recurrence, but also I was a bit triggered with that one because the anemia that I had also can give you lesions on your tongue, and so I was getting ulcers quite a lot. And I'm normally a pretty chill person. I'm sort of pretty cool, level-headed, and I was beginning to think, oh Lord, what if this is, it's not just an ulcer, it's something else, and it's sort of like upping the ante in my brain, and I just have to kind of like take a breath and kind of think, yeah, no, this is what it is, and it was all fine in the end. But it it does play on your mind. And I was, certainly with the talk of recurrence, I was kind of thinking, okay, this is not a good time. We've got to get to the end, like you guys have mentioned, just to get this baby out, and then we'll see where we are. And it's it definitely does affect things.
Yeah. And recurrence is never far from our mind, I think, in general. And unfortunately, we have got some people in our group who've had pregnancies and then recurrence during pregnancies and after pregnancy. So it must be incredibly difficult. And this is a bit of a pointed question because I always, obviously, I'm a massive fan of peer support and I think it's great, but I can also see some real problems with it, where when sometimes the advice you get or the experience you get from someone else might not be helpful to you. Did you experience any of that? Were you able to find other people through the Young Tongues who were going through pregnancy at the time, or did that not even cross your mind? I don't know. Did Young Tongues even exist at the time?
It was really early for me with my first. I think Young Tongues was probably less than a year old at the time. So I think it would be more scary. Not scary, that's probably the wrong word, but there'd be a lot more information to find now. And there is obviously several people that have had the diagnosis in particular during pregnancy. I guess I'm always mindful that one, you're going to hear more more stories when there's problems on a forum like that, because people don't write typically when everything's going well. But also, how many people would you expect to have would have a diagnosis during pregnancy? Is it because you're pregnant that you've got the cancer, or is it just because at any given time a certain percentage of people will be pregnant? And I think that's maybe the broader issue, is that there just isn't loads of data. I think SJ mentioned that earlier. And so, you're looking at peer-to-peer and anecdotal stuff because that's all you've really got. And there is obviously inherent dangers with drawing any conclusions from that.
That's a good point, well made. Thank you so much, Chloe. You articulated what I was thinking but didn't know how to say, and it's so true. And I do think in my mind, when I've been kicking the can down the road, I remember having a drunken conversation with a mate once, and he's like, well, what's holding you back? And I was like, well, we've got so many people who are pregnant and get diagnosed. What is if I'm like going to go and get pregnant and then I get diagnosed again? Like, is this me being really selfish, like doing this in the first place? Or is it selfish for me not to do it? So it's like, probably shouldn't have those conversations whilst drunk, but there you go. So Nat, what was it like for you?
So Young Tongues did fully exist, and I definitely relied on it at times. I know I shared in there when I was diagnosed because I was upset because we'd been trying and I was worried about what that might mean. Would we be able to have a second child? And I reached out on Young Tongues and people were incredibly helpful, which was amazing. I think probably around the time of me giving birth, just dipped out of it a little bit. Because sometimes you've got to. I mean, I've done it again since. Sometimes I just think I can't right now. Life's kind of, I don't know, stressful enough, and there's a lot going on. I think when I was having my second, it was more of I wanted to really enjoy that moment and just experience that, because you didn't know if that was going to happen. This is happening, so let's just enjoy that moment. So I think I just kind of dipped out, took a little break for a while. And since then have dipped in and out here and there where needed. And I think that can sometimes, because sometimes you just can't see those things or hear those stories when you're kind of in a very similar situation yourself.
Oh, absolutely. I wholeheartedly agree with you. And that's why we always say when we welcome anyone, we say, you're also welcome to leave at any point and welcome to come back, and mute it and come back in and out because it's too much. Yeah. I mean, says the woman who's on it all the time because I have to. But even for me, I've just been away for a weekend with no phone signal. It was bliss. I just had to put my trust in that someone else is going to take care of it in case there's an emergency. And it was great. by the way, no emergency. SJ, did you find? I remember. I think you put out some questions at a time about pregnancy, probably more out of curiosity.
I think I did a lot of searching. I was a member of the group while we were, sort of before we got pregnant with our second, and I was doing a lot of questioning then myself as to whether this was obviously we wanted to expand our family, and then cancer hit. And I had a lot of conversations with different people, consultants, colleagues, friends. I searched the group quite a lot. I mean, it's such a great mine of information, our group, and everyone's so supportive. And it's just useful to see that. I guess my main concerns were obviously, recurrence, and I've already got one little person. It's like, don't want to put myself at risk and leave him without a mummy. But at the same time, we wanted to give him a sibling, and I've wanted that from before watching what my husband went through, losing his own mum to cancer, and seeing how important that sibling relationship was between him and his sister, and sort of thinking, okay, well, I know there is a chance. It's rationalising, thinking there is a chance of this coming back, but I really want to give him that gift of a sibling so that he's got that growing up, and regardless of what happens to me, he's always got that sort of other person. But yeah, I asked a few questions, and I've asked a few questions about my son. Obviously, my eldest, he lived through the cancer with me, and he's still quite traumatized by that, I would say. But yeah, it's a great mine of information to dip into.
Was kind of going to be my follow-up questions. That's perfect segue, SJ. Obviously, most of your kids are also quite young. Nat, your first one would have been very young when you went through tongue cancer. How do they ever ask about, do they ever ask about your tongue or your arm, or they're probably too young, or what are your kind of thoughts about how you're going to explain to them like how precious they are because of what you've been through, I guess?
Let's go first on this one, shall I? So my first, initially when I had my pre-cancer, he was 1, but when I had my cancer, he was 3. And I was very conscious when I was diagnosed. He's a very sensitive soul, and I was very conscious of how to explain that in sort of terms that he could understand. And so I dipped into Young Tongues, and also dipped into Shine, who are like for young people with cancer. And asked the question, what did you guys do? And got some great answers. So I made him a book that had all pictures of us in, and kind of like told our stories. A little bit emotional, sorry. And that was really nice. It had pictures of us, and it just kind of said, Mummy will be in hospital for a little bit, but then she's going to get better, and the doctors will make her better and come back. And we still look at that book now, which is really nice to have that. In a weird way, we still both really enjoy that book. So that's really nice. He does still ask me about things. He does have a very vague memory of it, although we'll forget and say, what do you go to Bristol for, Mummy? And I'll remind him, do you remember Mummy's got a special tongue? And he said, oh yeah, I do remember now, Mummy, but the doctors made it better. And so we'll kind of have those conversations now. So he knows vaguely, but I kind of tried to keep it in a very, Mummy's going to hospital, but just to get better, and then Mummy will be back. And I imagine as he gets older, obviously, we'll explain a bit more to him. He does know, he can obviously see my scars, and he's seen my tongue. But he just kind of knows it is Mummy's special tongue, which is kind of quite nice.
Oh, that is lovely.
And my daughter's just about to turn 4, so she doesn't know, and it does worry me. It plays on my mind about how you sort of explain that, and on what point you explain that to a child. She's aware of my arm because it's still very sensitive around the graft, and she's asking more and more about when I say don't touch it, that's mummy's, when mummy's arm's poorly. But why is it not better? And I can see her starting to like put things together about that. I don't know when, and maybe the word cancer won't be so heavy for her because it will be a historical thing when she learns about it. Whereas, if you've got a child that's 7, 8, 9, it can be quite a heavy word and quite a scary word. So, yeah, my children don't know, but it does play on my mind about when is the right time and how you introduce that to not scare them.
I guess with me, my eldest was 3 at the time that I was diagnosed. You've met Maxie, Barbara. He's on the autistic spectrum. He takes things he was very small at the time, but he takes things very, very seriously. And so we had just explained that, mummy was sick and the doctors were going to make her better. And he very much wanted to come in, see me in hospital. And the hospital were really great. They facilitated that, so actually put me into a side room so that he could come and visit. And I mean, again, this was a bit of a weird scenario because it was the hospital I'd worked in. I'd actually worked in while I was pregnant with him. So all my nurses who I'd worked with throughout that time during my pregnancy knew me and sort of known him as he'd sort of grown up. And I think, the night before I had my operation, I was sitting there and I actually I recorded some. I didn't know what my voice was going to be like after. We didn't know how much of my tongue we were going to have to take, so I recorded things like the Gruffle Highway Rap on my iPhone, and they were just like listening out the corridor, like, SJ, what are you doing? And I sort of explained to them, I was like, well, in case I can't talk, I have difficulty talking upwards. This is for Max, and they just burst into tears because they've sort of known Max since he was in my tummy, which was quite an emotional experience. But we just introduced things gradually to Max, and he came to see me in the hospital. He had a look at my scar, and he had a look at my drain, and Heathcliff, came and had a cuddle, and he still remembers it, and I do think he is traumatized by it, unfortunately. And if I'm ever sick, he always says, "Mummy, are you talking? Are you talking?" Because obviously after I had the operation, I didn't have a flap, but they didn't stitch the tongue. They wanted to leave it open just in case I had a recurrence, and they had to go back in, and also to let it heal sort of in a bit of a more organic fashion. But it was quite sore, as you can imagine. For a while, it's a bit like having a large radiation sore just where the excision was. And so it still affects him because whenever I'm sick, if I've got a cold, if I've got a headache, because Mummy, are you talking? So it goes straight back then to that experience. So it's interesting how it affects them. I don't think I would have done things differently though, because of the way that Max is. He likes to, if I'd have shut him out of that process, I think he would have been quite hurt. So in a different way. It's it's always on your mind, and it is very emotive. I get, as we get emotive when it's the little people. It's I can take a lot when it's happening to me, but if anything that's affecting them, it's it really it cuts deep.
Yeah, it's really interesting. My in-laws brought my niece, which was tiny. I mean, maybe 2, 1.5, and she was very sweet. But I don't think she ever looked at me at the same way again. I put distance between us because God, I looked awful. I would have been scared of myself, let alone if you're 2. And I think it took her a moment to recognise me, and when she did recognise me, that was just all very, very scary. But yeah, bless her. So I do think it's, that wasn't necessarily my choice either, because I had said I didn't really want her there. But that choice was kind of taken out of my hands. But yeah, I think everyone knows their own children best and what they can cope with and what they can't. So yeah, that is one of the few things that I have a bit regrets for, that I should have maybe put my foot down a bit more and said, no, they have to wait until I'm at least in 2 pieces, if not in 1 piece. So yeah. So just looking at the clock, we're nearly coming up to the hour. I really wanted to finish with like a couple of points. And I think firstly, starting off with, if we think about our fellow young tongues, and if we think of our young tongues who are young and female and just newly diagnosed, so not pregnant, not trying at the moment, but just newly diagnosed, maybe wanting children in their future or planning or were planning to have children, what would you like to give on their way to take with them at this really early stage of how they can ask questions and help themselves a bit for the future, if that makes sense?
I think what I would say to them is ask the questions. You'll probably have to advocate for yourself, because that might not be given to you by the doctors without you asking. So if you've got the questions, even if it is way in the future that you're thinking about it, or maybe it won't, maybe you're thinking, I don't know if I want children or not, but still ask the questions, because then you should get some answers, hopefully. And that there is so much life after cancer.
Yeah.
Like it can happen. Yeah.
Tina?
Yeah, I think I would definitely echo that. I think sort of taking a bit of control back for yourself and raising that with your team and also your CNS, because they're in the UK. I don't know if it's quite the same setup elsewhere, but we're so lucky that we have this resource of the clinical nurse specialists, and they can be an advocate for you as well. They've also got a wealth of information, and they can get you information if you need it. And they, chatting to that team sort of provided me with loads of info about how I could take back control of the situation I found myself in. I spoke to my GP about it. My GP then referred me into ops, but I had to take that initiative myself. So I think if you go in prepared and you ask these questions, you raise them, it might not necessarily be on your team's radar. Obviously, their first priority is you, and they want to get you through it, and they want to fight the cancer. But obviously, you're not just the cancer patient, you're you, and there's so much more to a person than just this journey. You've got the rest of your life to go through and to live and to enjoy. And I think teams with the best intentions can potentially lose track of that because they so very much want to get you through it. But if you redirect them and signpost them, then they can say, okay, yes, we can speak to this person or that person, or it's getting you a little bit of help and information you need. So if you've got that, you're pre-armed with that, then you've got that under your belt and you know where to go for help. So how to approach it.
Yeah, I would agree. I think I didn't want to be a burden on my team as well. And you're very grateful that you've survived and, of what they've done for you. And I certainly didn't push. I took it upon myself to find the support that I needed, or felt that it was more on me. And I think I absolutely agree. Keep pushing. I wouldn't have gone to my GP, for example, to talk about it. And actually, maybe I should have done. Maybe, there was more support out there that I needed to advocate to access. But yeah, there are places to help. You've just got to push for it and ask for it.
We shouldn't necessarily need to advocate for those sorts of things for ourselves, but I think the other side of it is that our teams aren't necessarily used to dealing with younger patients, and with the best will in the world, they're kind of all these things are maybe slightly alien to them. Whereas I guess if you're on a breast cancer team, it's sort of very front and center in people's minds, whereas it might not have been something that our sort of surgical teams have come across that much. But it's good that you have that knowledge and you can sort of push and you can go and ask those questions, because it's so important. Because life is important, and we shouldn't be held. It's already enough going through this without having to have everything else affected as well.
Absolutely. And I guess my second question would be more from a clinical perspective. Now, I think, and as Jane made a really good point there, like our teams aren't necessarily used to dealing with people like us. And I have all understanding in the world for that. But also need to raise, it's becoming more and more common. So with that, if we are now in this unique opportunity where there is more need there, and I'm sure the clinicians that care for us, because they do care for us beyond the caring in the moment, are going to be upskilling and looking to create protocols. What would you like them to be? Like, what are the things that you would like people to research? What are the things you would like people to take into consideration? Be that a diagnosis, after treatment, or even being with your gynae team, you know, what are the things that you would like to see more of? And also from a research perspective, because Chloe and Nat, you mentioned it earlier about data, the lack of data. So what are the things that we should tackle?
I mean, even knowing whether pregnancy would have put my body at risk. How long should I have waited? What data is there about people that get pregnant that are not breast cancer patients? Because I think there's more on that, and if you Google it, that's what comes up. Having any sort of data around that would be useful, because I didn't know the risk, and I'm not sure there is much data that tells me how much of a risk it was. If it was a risk at all, maybe there was no risk.
Absolutely. And even just SJ saying about like how pregnancy suppresses your immune system. And I kind of knew all of that, but no one actually sat down and said that to me. So actually just having that conversation with someone would have been helpful, like just so that you're aware. Pregnancy obviously does suppress your immune system, so just something to bear in mind. I think that would definitely be helpful. And maybe even, I mean, there are groups out there are Facebook groups, which I went on and were very helpful for sort of pregnancy after cancer. But maybe having something like that or within the clinical setting, perhaps, could be helpful, even to doctors, perhaps, where they could kind of, I don't know, gather information, but also refer patients to, could be, yeah, really helpful.
Thank you, Nat.
Yeah, I think it's difficult, isn't it? Because we don't have that data, and we're still sort of a fairly small sort of niche group. But as you say, we are growing all the time, unfortunately. So clinicians need to kind of start thinking about addressing this, and maybe we do need some research, or maybe we need sort of a retrospective sort of cohort study, like the Young Tongues cohort, and look back at sort of ladies who've had babies after the cancer, because what we're saying that yes, we know that pregnancy does dampen your immune system, but maybe it doesn't have an effect. We just don't know. We can be cautious and say that, but are we then putting people off and affecting people when we know it's going to have an effect? So we just don't know. So yes, pushing the research, pointing out to clinicians that there are these other things that we need to think about. And I think, yeah, maybe utilising the clinical nurse specialists and Macmillan nurses to sort of like highlight those things and sort of signpost people through would be quite useful.
I think the other.
I also think sorry, actually this was about you, Chloe.
Okay.
Something that I picked up on.
Thing.
Yeah, but I'm just wondering if it was, and if we find anything, or anyone finds anything, please send it to me, and I'll make sure that we link it up on the new website that's coming. But I do wonder if there is more training available for gynae teams to help people navigate the pregnancy after cancer, young people who've had cancer specifically, because the mental health need of it all.
That's what I was going to say.
So, Chloe, I'll hand over to you for a bit more in depth. Yeah.
Was that there is, whether it's research or support or training about how to support patients through, from a gynae perspective and a midwifery perspective, because I think there's a bit of a void, or there was in my experience, a bit of a void there about how to do that.
Yeah. That's a really pertinent issue, and that is probably something that should be addressed in training. I mean, I'm not I know some gynae training myself, but you would have thought that there was some training at some point for that. But I remember myself sort of telling the obstetrician that tongue cancer, my elective section after the cancer, and just like the colour drained out. Oh my goodness, how old were you? And
Yeah.
you
It's
know,
always
it was
that
a
question,
bit of
isn't it?
a shock. Yeah, it was a bit of a shocker to her, but it's kind of, it's so important, and it's really important to do that well and to be sensitive to that, because it's completely natural that you would have that response after having that, you know, trauma of going through treatment for cancer. You'd be then triggered by going back into a medical setting. That's completely understandable, and yeah, we should have some way of addressing that and looking after you, and as you say, sort of putting you maybe on the first on the list so you don't have to wait around, and you know, addressing your concerns and making it, not making it all better, but making it as smooth a process as we can for you, bearing in mind what you've been through.
Yeah, I think if you
But
could
I
have more
know of an
continuity.
organisation.
So I was just say, if you have
Yeah,
more
sorry, Chloe.
continuity of care as well for a cancer patient, I think that
Yeah.
would make a big difference. Sorry, Barbara.
I think this is
No,
something
no,
that's
that's
being addressed nationally at the moment, isn't it? With maternity care, there are lots of problems in the UK. I mean, it probably doesn't translate necessarily to other countries, other states, but we're having a big shake up of our maternity services at the moment. You've probably read it in the news. So one of those things that is a big issue is continuity of care. I was really fortunate with my last pregnancy to have the same midwife all the way through my antenatal care, which is the care for you of your baby, and it made a huge difference.
Yeah.
Something like that probably would have helped you quite a lot.
Yeah, echoing what you said earlier about not seeing the same person more than once and then having to retell that story every time. And actually, I was thinking, our friends at Shine Cancer Support would probably be the perfect people to tackle something like that. Not to put more work on them for another charity. But yeah, anyone who's not familiar with Shine Cancer Support, they're a brilliant, brilliant charity. They specifically offer support for young people who've had cancer in their 20s, 30s and 40s. And kind of specialise in that. And they were a huge help to me personally when I first was diagnosed. And they are just brilliant, lovely people. And everything they do is really, really great. So maybe I'll bring it up to them next time I see them and go, oh, by the way, I have a little idea in case. I'm sure they'll love it. Yes, and on that, I now just lost my train of thought because I did have one more question before we finish off. But oh dear. Yeah, no, it's gone now. Never mind. It couldn't have been that important. But I guess no, thank you so much to the three of you for coming on and sharing your experiences. I really, really appreciate it. Oh, yeah, no, it's come back. Sorry. Brain has caught up with Barbara. So the last point I wanted to actually contribute to what I would like to see from clinicians. And I'm really conscious that we have 4 people here who had quite a low stage tongue cancer and didn't have radiation and chemo. So none of us had to go through the heartbreak of having the surgery, having the radiation, doing all this waiting in between, then finding out needing chemo radiation, and potentially facing infertility. And we've had those stories. We've had a few on the podcast. I'm hoping that we will have a few more in the future, where we've had many young women being completely heartbroken and asking the question, why did we not start the process of preserving fertility preserving measures when we still had time? Even if we didn't actually harvest the eggs, but if we would have started the admin for it, and we could have always aborted. And I'm sure there are some structural answers to that, but I would like to actually see some research, but I want to see a protocol of really who should be offered and at what point, so we don't delay the really important treatment that someone is having, and what people can do to advocate for themselves. So as far as I'm aware, we only, out of the hundreds and hundreds of women in our group, we actually only have one woman who had a fertility preserving treatment, and that was only because she doesn't live in the UK and she paid for it herself as soon as she found out she had cancer. So the whole SJ.
I went through fertility preservation.
Oh, you did?
But I had to push for that. Yeah, I had to push for that. I didn't think that I would be eligible because I already had a child, but because of my history, as I mentioned before, with the the premature ovarian failure in the family and my age, and with my consultant having said that you need to wait, they deemed that I was eligible for that, so I went through a course of fertility preservation. But it was because I raised that question through my GP.
Wow.
There we
And
go.
I don't understand and that is also probably partly because I have medical knowledge myself, and I can advocate for that.
Yeah.
But obviously, it is an issue if people have chemotherapy in particular, or the radiotherapy that affects your sort of gynecological organs. But it's the way it was explained to me is I was assessed, and they gave me a pretty bleak outlook actually at having a baby naturally. So they were my team were very much sort of umming and ahhing as to whether I would need radiation at a bit of a later stage. They're keeping quite a close eye on me. So they did put me through that. They gave me that option, but they were very guarded, and they basically said that it's not don't count on it as an insurance policy or a backup. It's another option if you need it, but it's not necessarily going to be successful. So I came out of that whole process with the feeling that it's not a definite. It's not your backstop. It's kind of it is another option, but don't rely on it, kind of thing. But maybe my personal medical sort of situation, but I very much had to push for them. And I think it depends on which area you are in the country as to what funding is available. You have to pay certain parts towards it, depending on the area that you're in. But yes, it is an option. I did have to ask, and that is something that I would absolutely recommend that people discuss with their team. My team weren't that keen on me having it, but it was something that was very important to me. And I went through my GP and they referred me.
That's amazing. I'm so glad I brought that up now, because that's really, really valuable. Yeah, but you are right in terms of like every region, and for the purpose of Young Tongues, every country will be different as well. And I'm seeing it where I am in terms of IVF. I will not be able to get IVF because of I have a condition called lipedema, which means I will never be able to reach my BMI, no matter how many fat jabs I take. Just not going to get there. And there is, where I live, consequently no wiggle room whatsoever. In a different county, they have a little bit more leniency for pre-existing conditions. In my county, there is just a really hard no. So even if we would put a guide together, it would have to have so many asterisks and so many like, oh, but not in these areas, but in these areas. But I think overall, I hope anyone listening to this is really encouraged by your story, SJ, to, if this is important to you, push them on it. Yeah.
No, it's such an important part of who I am to be a mum, and I really felt that from what I've been told by obs and gynecology at that point, I really thought that I wasn't going to have that opportunity to have another baby, and that was really quite devastating to me. So I would absolutely encourage anybody who even has that question in their mind, even if that's a long way in the future, go and discuss it with someone. Get your GP to refer you to someone who can give you all the information and let you know what the options are and where to go. So again, you're arming yourself with that information, so you know.
Yeah. And then also, still post into Young Tongues group and ask what other people have done.
Yeah.
Because sometimes that information also really helps to go and say, oh, but best practice, so-and-so had this and this in this county. And sometimes it just helps the competitive nature of clinicians to get you the best care possible. But I just wanted to say thank you so much. Nat, Chloe, did you want to add some final words from yourself?
I I guess just that we've sort of talked about some of the things that were really hard, but I think someone's mentioned it already that, there is a life after this. I'm conscious not for everyone. I'm very lucky to be in the position that I am. But for people that are perhaps newly diagnosed, it's so scary, but, I've had 2 beautiful girls after this. So we hear lots of those scary stories as well. And that is very real. But there's also this other part where there can be hope as well, I guess. I feel very, very lucky to be able to have 2 beautiful girls.
Absolutely. Thank you, Chloe. Nat, did you want to add anything?
I think that we've kind of already covered everything. I think the most important thing is to advocate for yourself, and exactly what Chloe just said there, that there can be and there is these beautiful moments after cancer, whatever that looks like. It can be children, it can be other things as well.
I can only echo that. So on that note, thank you so much, everyone, to listening to another one of our pods. We'll be back with another panel discussion on a completely different topic. I do kind of pull them out of a random hat to keep them as random as possible. I'm sure we will be returning to pregnancy and fertility, but also motherhood, parenthood, fatherhood, and so on in future discussions as well. But for now, thank you so much, and we'll see you next week.